the simple things in life. Either it does or doesn't feel right. It's the simple things in life. Come on, baby, let's ride.
Good morning, everyone. Luke, who came with me to the doctor, say good morning. He's playing checkers on his phone. I just messed him up. It takes for me to go in the hospital for him to attend a doctor's appointment, y'all. So we're at the lung doctor waiting to be seen. I slept good because I was pretty much medicated. My face is numb this morning. I have not taken any of my medication. Definitely got to hurry and get the aspirin in me, but I'm having a hard time trying to eat enough this morning, so I overslept. Didn't make the ultrasound, which I wasn't going to go, but I did not get a chance to call to cancel it. So we're just sitting here waiting. I'll come back once we are out of here.
Hey, hello, how are you guys? You have lupus, you were having shortness of breath, you were on Celsip, 1,000 milligrams twice a day. Your breathing test was normal, but I thought that you may have pulmonary hypertension. And then I said, okay, you had a questionable positive asthma test. So I said, let's try you on some breathing treatments. And so I ordered a BQ scan, a CT, and some blood testing. Okay, so, right, I got all that. So let me see, since you were here, what do you have done? You had the BQ scan?
Yeah, I think my methacholine, is it DC low, was very low. You were concerned.
Yeah, that was very, very low.
Mm-hmm. And you were talking about exercise-induced.
And the BQ scan was normal.
Mm-hmm.
Okay.
And we repeat the CT scan because we were thinking the infusion could have been the trigger, and we stopped the infusion between you and the rheumatologist.
So since last appointment, we had a BQ scan, which was negative, normal. She has had a right cath, which showed no pulmonary hypertension.
I have not had since our
no,
last
but
appointment.
you had one.
Yeah.
She had a positive methacholine for asthma. They stopped the belimumab.
Mm-hmm.
She has stopped the belimumab due to concerns causing shortness of breath.
Mm-hmm. You ordered a whole slew of labs, IgGs, and all of that. I don't know the results of it.
Okay, let me look. All that was done in July, right?
Mm-hmm.
Okay. You had an allergen test that showed a bunch of allergies. Cat and dog and a lot of different things. That will be consistent with possible asthma. You had a thank you. Thank you. There it is. Where is the IgE? They didn't send it. I'm looking for your IgE, which is a test that looks.
Okay, it was at Quest.
Huh?
It was at Quest.
Yeah. Oh, 344. It's elevated. You have asthma.
Really?
Which is actually better than the alternatives. Pulmonary hypertension, lupus-related lung disease, all those things are really serious.
Wow.
Now, how much of I have no idea how much of that antibody for the treatment for the lupus could be contributing to some of what has happened to you. Because asthma is an allergic, basically, disease, which basically means your body kind of is exposed to things and it reacts. It's just like, I don't know, shrimp.
Yeah.
And then it creates a reaction. So medications are, what we call antigens, which basically means things that your body, they don't belong to your body. So when you take a new medication, sometimes people react to them because they're like allergic to penicillin because they're like, I don't like that stuff. So I don't know if the medication they're giving you could have triggered some allergic reaction. It's hard to tell, and I don't think anybody knows because that medication is relatively new.
Correct.
But I don't know if she feels that medication was helping you and it's needed for your lupus, I would not mess up with that. But right now, I think we have evidence that you have, asthma, and that could be explaining your intermittent shortness of breath. Okay. Is that shortness of breath about the same?
Yeah.
It comes and goes?
Yeah. I mean, anytime I'm walking, I'm short of breath, so. But
Yeah.
like, I'm not exposed to cats and dogs.
Yeah, and the test actually shows, not only cats and dogs, it just shows a bunch of, allergens.
Okay.
Grass as well, and cockroach. It doesn't say all the
basic stuff of life.
Yeah, a lot of the different things though are negative, but a lot of them are positive. That's a screening test to confirm which ones you're allergic to. You got to do a skin test, but I wouldn't do it.
I used to do allergy shots when I was little. So.
Yeah, right. Okay. She remains.
I'm not seeing Dr. Brown anymore. She discharged me.
Oh, really? Oh, that's not good.
Yeah.
Who are you going to see?
I have no clue. I just got out of the hospital yesterday.
From what?
I went in on Wednesday. I've been having facial numbness for a month. And Wednesday I started having severe headaches. And my right arm went numb. So they thought I was having a TIA. And they ruled it out. And they said I was having complex migraines. And I called her office before I went in to try to get in and see her. Because since she took me off of the Benlysta, my stomach has just been really upset and I couldn't tolerate the Cellcept. And so I stopped it on Sunday until I could try to get in to see her. And apparently she got upset because I stopped it.
And stopped the
Cellcept.
Oh, okay.
And I called, I said, hey, can I get in? They never called back. I called back and I talked to the nurse. I said, hey, I had to stop, but can I please get in and get a work-in appointment? And they never called back. And then they called me the next day, and I was like, well, I'm already in the hospital. And they said, well, we're not calling you about that. She wants to discharge you because she doesn't feel she can treat you because she feels you treat yourself. And I said, well, how do you feel that way? I said, I'm deathly sick from the Cellcept. So what am I supposed to do? Just keep taking it, being sick?
No, I agree with you.
You know, and so she was like, well, we're only giving you 30 days to treat you, and she's going to send you a letter. And I was just like, whatever. Like, I've been with you for 3 years. I've never been discharged as a patient from anybody.
That's crazy.
And that's what I said. So, yeah. I see my primary Thursday, so I'm going to see.
Why don't I can send you to another rheumatologist.
Okay.
There's one that I think she's really good. I don't know. I mean, the reality is that, different doctors, they have different levels of compassion and bedside manner is different. There's one that is she's more senior and she's a little more compassionate.
Okay.
I think she's probably better because she's more, she's like in my age spectrum, mid-40s, and so she's very kind of aggressive, but she wasn't really that compassionate with my wife. So.
Oh, your wife has lupus?
Well, no, she had something else. She had positive ANA, positive rheumatoid factor, and then she had a similar interaction that the nurse called her on the phone and she said, you got to do this, and my wife was wondering if that was the right thing, and then they called her back and said, well, you're not compliant, but you're not doing what we tell you to do. And so my wife got upset, and I got upset. I said, well, that's not cool.
I don't have time for.
Yeah,
And that's kind of like
we need to I'll say like her. We'll go to the sometimes you gotta just have to be smart and play by ear
And when you've been in the medical field, and that's one thing with me and Dr. Brown, like she's a sweet person, but she was inconsistent. Like other patients that were in the lupus community, like if I had a cold and got on antibiotics, Dr. Brown would stop my CellCept. But other patients, she would never stop their CellCept. Right. So my body would go haywire because she will always take me off of my meds. Mm-hmm. And then she wanted me to do sulfasalazine. Mm-hmm. And I said, well, I thought lupus patients couldn't do sulfur-based drugs. Oh, no, you can take that. And I said, well, it says it's for RA. I don't have RA. Mm-hmm. And I was like, sulfur drugs have messed me up in the past. I don't want to do sulfur. And so she would just kind of get upset instead of saying, let's look at some other options. I understand your concerns.
Well,
you know what I'm saying?
I'm not a rheumatologist, so I don't want to
step on toes.
Speculate. But all I can tell you is that you do have a history of allergies. You had a positive asthma test. You have a high IgE. Okay. All of that are suggestive of asthma causing your shortness of breath. I don't know if that's only it, but I think we need to treat that. Okay. Now, if you don't get better or if you were having evidence of severe asthma, there are treatments against the IgE. Okay. So there's what we call anti-IgE treatments that will just reduce your IgE levels. But because of your history of lupus, I don't want to give you more IV stuff. Yeah. Those are shots that once a month or once every other month. I'll give you some information. Typically are reserved for moderate to severe asthma, which basically means people that are having attacks and things. To me, yours is more like intermittent shortness of breath, which could be multifactorial. A little bit of asthma, a little bit of lupus. And even if lupus doesn't show on the CAT scan, it doesn't mean that you're going to be having problems. There's one condition I think I explained to you before. Mm-hmm. It's called exercise-induced pulmonary hypertension. The only way to prove that you have it is by doing an exercise cath, which is, but the question is, are we going to do anything right now with your treatment? Probably not if your oxygen stays good. Yeah. So let's try this thing, make it simple. Try the asthma treatment first, and then, one step at a time. Otherwise, we just get confused.
Yeah, I agree.
We could do a cardiopulmonary exercise test, which basically means it measures your lung reserve, your cardiac reserve, and it will kind of tell you more towards the lung or the heart. The problem in young people, most of the time they get really upset because you cannot. So the test basically makes you run and then or do the bicycle, and he put this threshold in here, and then you're supposed to be reaching that threshold, okay? And then if your heart doesn't work, basically it will show that your heart flats out before you reach the threshold. If your lungs don't work, then you show that the lungs flat out and the heart keeps going up. But the problem in young people is that most of the time, you really can't, they put the thing so high that you can't really reach it, and then you end up with a test that says, oh, you're just deconditioned. And so I don't want you to go through all that so they can tell you need to lose some weight and you're out of shape, because you gotta be like, you knew that in the first place, so that doesn't help me feel better.
Exactly. So would that cause for my heart rate to always be on top of just being out of shape, being 115, 120 all the time?
No, I don't think that's normal. I suspect that you have what we call vasoreactivity from lupus, which is basically means normal people, when exercise, the vessels open up. It's like you're pushing the gas and then you get more fuel into the engine. Mm-hmm. In your case, you're pushing the gas and they do this. Gotcha. And then you choke because you're like, I need, and that's what happens when you have pulmonary hypertension. But the CAT was negative, so your case is difficult in that regard because, if you were my family, I'll tell you, let's be patient, treat the simple things, get on a good treatment for lupus, be patient with your symptoms, try to lose some weight. If things continue to get worse, I can send you somewhere else to get a more sophisticated evaluation. I wouldn't do an exercise cath in here in Pensacola because they don't do it. I don't think they've done it in 6 months. So if I send you to do something here they didn't do routinely, then I don't know if they're gonna be able to interpret it.
Exactly.
So you know, if we have to do that kind of stuff, I'll tell you, okay, we gotta go here, we gotta go there.
Yeah.
But let's just, you know,
Start little.
okay.
So do I just continue the Combivent because I feel.
Yeah, well, we need to
Combivent
put you on asthma treatment.
Oh, okay.
So Brio, Dulera,
The Brio
Symbicort doesn't work.
It makes me cough really bad.
Okay.
And the Combivent, I feel it works, but I can't take a deep enough breath in.
Okay, hold on. Patient has tried Combivent, but feels that she cannot take a deep breath.
Yeah.
She also has used Brio and makes her cough. Now, the problem is the copays and the cost of these things.
Well, my Medicare.
I'm going to
only
give you
have a-
samples, but
Okay.
then if it ends up that this is too expensive, then, you know, either you come back and get more samples from us or try to find out, because there's not that many asthma treatments. There's Advair, Brio, Dulera, Symbicort. Those are the asthma treatments available.
Well, apparently the PFT lady, the Combivent I have is that spring-loaded one. So she was saying maybe the other one.
The Respimat? Yeah.
The puffer one.
The puffer, not the
Versus the
spring.
spring-loaded
Yeah,
one.
you don't feel it.
Yeah, it would be maybe better.
Yep.
So maybe if I could
The other
switch
thing we can
it
do
up.
is we can do a Spiriva, but you think your breathing test wasn't bad, actually. I thought it was really good. Yeah, your breathing test doesn't suggest asthma at all.
Yeah.
And
so
it
that's-
shows, your breathing test shows that you have very substantial reduction in your oxygen diffusing capacity, which that will be suggestive of what we call pulmonary hypertension.
Yeah. So that's why I was confused because at first I didn't think my methacholine even showed asthma.
No, it don't.
Oh.
It showed. So typically, when you have asthma, there's a stage 1, 2, 3, 4, and then 5 is like super high doses. Yours drop in the very last one.
Mm-hmm.
That's when you react to the mild dose. That's highly suggestive of asthma.
Mm-hmm.
When you react to the high dose, you could or you could not, because you could be normal and you still react
Okay.
because it's such a high concentration.
Yeah.
But if you don't have history of allergies,
Yeah.
I think it's reasonable to treat you, even
Yeah.
if we're not 100% sure. Now, that would not explain why your oxygen capacity is reduced
Okay.
in the breathing test.
Yeah.
And that's what I still suspect, that there may be a component of pulmonary vascular reactivity.
Okay.
Now, have you ever tried a calcium channel blocker?
Mhm.
Like, is that your blood pressure okay? Your blood pressure
Low normally.
low?
Yeah. I don't want to bottom out.
Because sometimes what they do is a pulmonary, and I don't think Dr. Amin did it. They do a pulmonary vasoreactivity test,
Yeah, he
and
didn't, he didn't do that.
and so if you have a little elevation, they can give you a blood pressure medication that makes the vessels dilate, and it helps with exercise.
Oh,
But it's a blood pressure medication. It may drop your blood pressure.
I don't
It's called cardizem.
I don't want to do it.
Hmm?
I don't want
Want to do that? Okay.
I know while we were in Iowa for the 10 days for the Junior Olympics, I told my husband, like, I barely had to use the inhaler because the altitude was higher there.
Right.
Like, I could breathe.
Right.
We had to move the owl.
Let me put in. Okay. Let me go see if I can get you some samples. Okay.
Thank you.
Go on.
Hey guys, so it's about 7 something at night, and today has been weird. I did go to the doctor's appointment, but while at the appointment my head was hurting so bad, my face was pulling, the numbness was so intense, so my husband we had to go find something to eat so I could take the slew of pills that I have to now take. And then I came home and laid down. And I laid down, I got up. The face was still numb. I put some ham hocks on last night because I've been wanting just some ham hocks and beans, something a little bit more healthier. And so I put the beans on, I laid back down again, And my face is still really numb, really dizzy. And now my husband is laughing. You just said it didn't need no more. I told you it needed more. I told you. So it's gonna be a while before we can eat. I'm so hungry, y'all. So that's where we're at. And we're trying to figure out, he's asking me like what causes it, what are the triggers, and I can't answer all that because I don't know myself. But you can take the Fiorset, I want to say it's like every 4 hours or something, but my thing is, do I have to take this medicine every 4 hours just to function? Because I've only taken it once today and it is horrible right now that I don't have it in my system. And I don't want to have to be like that. My words, I'm having a hard time getting them out a lot today, whereas before that was not happening. It literally is like the numbness is the entire half of my head, whereas before it used to be like just like this part, but it's all in the back of my head. So I don't know what's going on, but both hands are numb. It's pretty intense and frustrating. But the lung doctor, so apparently I guess I have asthma among some other issues, but hopefully you'll hear that in the video. He's going to send me to a new rheumatologist. I'm very thankful for that. So my old doctor is supposed to send me a records release. I need to go check the fax machine so I can get the ball rolling to get my records, because I will be hand picking those up because I don't trust them to send anything at this point. Yeah, so that's where we're at with that situation. What else? I called my neurologist to try to get in, but they were like, they needed my hospital records and they couldn't access them, which they never tried, before they could make me an appointment. So I have to see my primary on Thursday and get them to send my records over so I can get in before they can see me in October, because they're going to be the ones to help me with this situation with these headaches. And the one that I normally see, she's on maternity leave until October, so I would have to see one of her partners, which I don't think I'm too happy about because they don't have the best bedside manners. So we shall see what is the best option, and I may ask them to let me see the doctor that I saw in the hospital. She was pretty nice. So we'll see. Do you want to say hi? Yeah, see, that's what happens when you got no strength in your hands and you're numb. You like a big what? What'd you say?
That blob with a head on it.
He said he looked like a big blob with a head on it. As long as you know. And now he's trying to be the weight police to tell me, the doctor said I needed to lose weight to be healthy, as if he don't need to lose weight.
Let me do the scan.
As if he ain't fat. Really? If anybody, we both need to lose weight together. That's just all I'm saying. Alright guys, so it's about 9:42. I just took the first round of my night meds, and I'm trying to hold off as long as I can to take the migraine. It's closer to when I fall asleep. So I'll take my Fiorset, my Phenergan, and my Topamax. Is that my Topamax? No, I already took the Topamax. That's a prophylactic to help decrease the migraines, and of course that takes a while to get into my system. So I'm going to take, the Fioricet, baclofen, and Phenergan closer to bedtime. That way I could try to sleep more throughout the night and not have to try to wake up. The numbness is pretty intense. So tomorrow I don't have any appointments. I cancel my MRIs. So I'm going to try to take it at least maybe every 6 hours and see if that helps with the numbness. And I'm just going to have to bite the bullet and rest and listen to my body and see how it works. But I just wanted to close out the video because normally I never close it out. And just to tell you guys, thank you for the prayers. I really appreciate it. And to be blessed. And I will see you guys, the Lord's will, on the next vlog.